Hi, everybody. I'm Scott, and thanks for joining us again today for another episode of the In Medicine and On Medicine podcast. As always, this is Susan. Hi, Susan.
Hi.
Susan is an Oriental medicine doctor and East Asian medical practitioner here in the Las Vegas, Nevada Valley. Her information comes across the screen every so often. If you'd like to get in touch with her, if you have questions, want to make an appointment, comments, which you may also do in the comments section below, and we will try and get answers and responses to you, and anything else you may need or have inquiries about. So today we want to remind you that even though we're approaching spring, it is not yet the end of cold and flu season. So we want to talk a little bit about, as always, the differences between East and West, how they look at cold and flu, and what Susan does with Oriental medicine and Chinese medicine to help you treat both of those fun conditions that come and go all throughout the winter and sometimes the spring. So where do you want to start with cold and flu? Looks like you have
Well, apparently...
a patient.
Yes. Just make yourself at home. Okay. So, cold and flu. So like in Western medicine, there's the cold virus, which has, where they've developed over the last 10, 15 years, some ways of dealing with the cold, of shortening up the amount of time that people suffer with a cold. The flu, there's usually one or two or even more strains of flu that come about every year, and they figure out, how to make a flu vaccine. Sometimes they're right, sometimes they're not. And we all know kind of what those symptoms are like. They're pretty miserable, colds, sniffling, sneezing. You could have chills, sore throat, cough, that kind of thing. So one thing about the Las Vegas Valley, though, in the Mojave Desert here, is that there's so much, I don't know what you want to call it, stuff in the air.
Right, because of all the dust and
the dust
breeze,
and the
and
pollen.
we're in the windy desert. So.
Right, and so it's very windy here, and so pretty much almost everyone has some kind of thing that they call allergies or seasonal allergies, which in a lot of ways can really resemble a cold, not the flu so much. But so I kind of, in Chinese medicine, we sort of lump all that into.
Oh, really? Okay.
Well, sometimes. Yeah,
Okay.
sometimes. I'll tell you the difference in a minute. So, but as far as cold and flu go, there are things in Chinese medicine that cause diseases. Okay. And we call them EPIs, external pernicious influences, which you can think of as a germ, if you want. There's something that comes in from the outside and invades. Okay. And there's heat, cold, wind, damp, dry, and some summer heat is heat and damp mixed together.
Okay.
Pretty much. Okay, so of those 6 EPIs, the one, wind, it is the one that the other ones kind of ride on to get into the body.
Okay.
And this area of the body right here on the back of your neck, okay, that's called the wind gate. And that is an area where the wind can get in.
Okay.
So we actually did an episode called Wind is Bad, and wind is pretty bad. So as far as Chinese medicine is concerned, you never want wind to be blowing on you because it's always bad. And not just wind outside, but, air conditioners and anything.
Because
blowing.
it's a transport system for everything else bad.
Yeah,
right,
and it's bad on its own.
It's bad on its own.
So it's bad on its own, and it's bad when it hooks up with other things that are bad. So that's what colds and flu are. So in Western medicine, you catch a cold. Well, in Chinese medicine, you can catch a cold or you can catch a heat.
What does that mean?
Well, it's a little bit different.
Okay.
So when you catch a cold, it comes in back here. Okay. People have a stiff neck. They have tight muscles. They're achy a little bit. And if they have, we call it chills and fever, but I don't necessarily mean a fever you can measure with a thermometer. It's more just like a feeling of heat. So they might feel chilled. They might have a feeling of heat, but the chills are worse than the heat.
Okay.
Okay. So it's kind of a stiff neck kind of a thing, sore muscles kind of a thing, feeling chilled, that kind of a thing. Those are the main symptoms, and then they can have all kinds of other symptoms like cough or stuffy nose or whatever. But the main symptoms are these ones that come in back here, and then a wind heat comes in this way.
Oh, okay.
So that starts out with a sore throat, stuffy nose, sneezing, that kind of thing. There might be chills, but the chills are far outweighed by the feeling of heat. You feel hotter. Okay. So they're the same kind of thing. They would be what in Western medicine is called a cold, regardless. But as far as Chinese medicine goes, the treatment is quite different.
And that's what I was going to ask. So that's why you separate them, is because of the treatment.
Right.
Okay.
So that's the thing with Chinese herbs that is a little bit tricky, because like, let's say you're just a regular person and you go to the health food store and you see that there's this herbal formula for colds and flu. You kind of have to know if you've got a heat or a cold, right? To know which formula to take. But there is a formula, a modern formula, that I like to tell people to keep around the house, which is called Ganmao Ling.
Okay.
And Ganmao Ling is a modern formula. I don't know how old it is, but it's less than 100 years. So that's like yesterday in Chinese medicine. So, and it's a great formula because you can take it when you feel like you're coming down with something, but you don't know what it is. And I'm not like any sort of like paid proponent of Ganmao Ling. It's just a suggestion.
Right.
So
it's like having aspirin or Tylenol
right.
or
So it's
acetaminophen
great, and you can be coming down with an ear infection or conjunctivitis or anything. It's like you wake up in the morning, you feel like you're coming down with something. Ganmao Ling is great. Doesn't have
And what
anything.
does it do?
Well, it either kicks the symptoms out before they get deep enough to make you really sick.
Okay,
And I'll
that would
talk
be
about that in a
great.
second.
Okay.
Or if you do get sick, like if you take it for a few days and you still get sick, it shortens up the amount of time that you're sick. So it's kind of good. So you take it, it for the first 2-3 days. If you still get sick, quit taking it, because once you're sick, it won't help you at all. But it's pretty helpful at trying to just boot it out before it really gets in, because it takes a little bit of time for the EPI to actually get into the body.
And you feel
it.
You get an advance warning.
You feel like, am I coming down with something?
Right, or my throat scratching,
or
why am I chilled all of a sudden?
Why do I feel so chilled or fatigued, or like, what's going on with me? So that period is very important, because we have, we've talked about chee before, right? Chee. And there's a bunch of different kinds of chee, and one type of chee that is ruled by the lung system in Chinese medicine is called the Wei Qi. And the Wei Qi is on the surface of the body. It's about it's a little bit off the body, and then it also fills what we call the space between the skin and the muscles, which is called the coolie. Not that anybody cares, but anyway, I think of that type of qi as like our armor. So if the lung system is strong and the Wei Qi is strong, the Wei Qi can fight off whatever it is that's trying to get you. And if your Wei Qi is not as strong as maybe it could be, or if the pathogen is very strong, then it can penetrate the Wei Qi, and then it gets inside the body, and then you get pretty sick. So that would be more like a flu kind of a thing. So So
you do differentiate between cold and flu?
Yeah. So the flu has gotten inside. So the cold can be in what we call the exterior. Okay, it hasn't penetrated all the way to the interior, and so you don't have internal organ systems symptoms, like, for example, nausea and vomiting. I mean, once that happens, it's inside. And so now you've got the flu, or you've got something akin to the flu. And so so that's kind of the difference, is, do you have internal symptoms or not?
Okay.
And again, once it's inside, then Ganmao Ling won't work, and you have to focus on another type of formula. And there's a few external formulas that work on wind heat or wind cold, and then there's some good ones.
Let's go in order of treatment. So Ganmao Ling, you do at home. That's your first line of defense,
right?
And then what? Now what do I do? Now I feel something coming on.
It's not working. Right?
Okay, right.
So if you feel as though you're really coming down with something, you might actually have an actual fever, or you might be feeling nauseated or something. one formula that I really like to go to, and pardon my terrible pronunciation in Chinese, I beg your pardon, Huaxian Jiangqi which we
Okay.
can put it up there. And that is a really good formula for a few different things. It's really good formula if you feel like you're coming down with the flu and you've got some internal symptoms. It's also a really good formula for traveling, because if you travel and you end up getting some sort of travel related illness, like from, like nausea or diarrhea or something like that, sometimes that formula can be kind of a nice thing to bring with you when you're traveling or you're on a trip, because it kind
Okay,
of
but so should we?
addresses a bunch of different things.
So even taking a step back, as we just figure out that and feel that there is some sort of invasion happening, and we start hitting the Gamaling, should we be getting to you right then and there? Like
Oh, yeah. So,
what are the orders of things we should be doing to knock this out fast and
right. So this doesn't usually happen in this country because people don't think of us first. They think of us last. So I always tell people, if you wake up in the morning and you feel like you're coming down with something, come see me.
Okay.
Because the faster something comes on, the faster we can get rid of it. So, for example, once in a while, people will come in and maybe they're coming in for something completely different, like back pain or something. And they come in and they go, boy, I woke up this morning and I feel like I'm coming down with something. And it's like, okay, we're not treating the back treatment. Now we've got to identify the pathogen that's trying to get in, and we have to expel it.
Okay.
And there are acupuncture points that do that.
Okay. And how do you determine this?
And how do we determine this? He asks. We determine this by the pulse.
Okay.
Okay, so we've got the pulse and the tongue, two big diagnostic techniques that we use. The pulse changes immediately. The tongue changes slowly over time. So the tongue doesn't really help us when we're coming down with something because it doesn't have time to change, right? But the pulse changes immediately, and there's a very, very clear pulse for when you're coming down with something. It's like obvious.
Okay, and then what about? Are you able to tell the difference between that which is a cold and that which is a flu? I mean, obviously we can tell by the symptoms, but
So the pulse tells us when something is in the exterior and is trying to invade. So that tells us when you're coming down with something, but it doesn't specifically tell us what.
okay.
However, if you actually come down with something, okay, and it's penetrated and it's gotten in, then sometimes the pulse can give us an indication of whether it is more of a hot condition or more of a cold condition, and also what organs specifically it might be affecting the most. Like, is it more about the lungs? Is it more about the gastrointestinal system or something like that? So the pulse can tell us some things like that. And then if the person is sick for a few days, the tongue starts to change, and then we can see some changes in the tongue.
Potentially ignorant and stupid patient question here. If in those early stages you can't tell which is which, how do you know how to treat?
If I can't tell if it's hot or cold?
Yeah.
Oh, because I can just treat it as both.
Okay.
Right? So I can treat, I don't need the specific right at the beginning. Okay, because there's stuff to be done. That's one of the reasons Gunmel Ling works. You
Okay.
don't have to know if it's a heat or a cold for Gunmel Ling. But as the disease progresses, if it doesn't boot it out right away, then you have to know which is which, and it's really not that hard. You can feel it in the pulse pretty much.
Okay, but in that early stage when we're coming down with it,
Then it doesn't matter.
Then it doesn't matter.
Then it
Okay,
doesn't
because you're just putting up a general armor
Correct.
that's gonna protect against
Yes,
whichever.
we're just saying get out whatever you
Okay.
are.
What about when it comes deeper?
Yes, so then it comes deeper, and then you do know if it's hot or cold. And mainly you know if it's hot or cold because of how the person presents. Like, what do they say? What are they feeling? Are they sweating? Are they not sweating? Or do they feel hot? Do they feel cold? All of that. That tells us exactly what's going on. But then also their pulse will tell us too. So
Okay.
their pulse just supports what they're already saying.
Right.
Like sometimes patients will say, like I can't remember exactly how they put it, but something like, well, like how do you know? How do you know I'm being accurate, or like how do you have to depend on what I'm telling you, or I can't really describe this, so how are you going to know what to do? And I always tell them, well, yeah, I don't really need you to describe it because I have your tongue and your pulse,
Right,
and the
right,
tongue
right.
and the pulse never lie. So, which is interesting. I just had a patient a couple days ago who's an acupuncturist, and what did she say? She said something, and I looked at her and I said, the tongue and the pulse never lie. Oh, she had mentioned something about being overweight
Okay.
and how being overweight was a manifestation of a disease causing entity called dampness. And I said, no, it's not. And I've heard very, very experienced practitioners, people who have been doing it 10, 15 years, maybe not as long as me, but a long time, who have said, oh, overweight is a manifestation of dampness. That is absolutely untrue. I've actually been in schools where teachers are teaching students that is the truth.
Okay. Well, we won't
It
go
is.
too far on a tangent because we
It's
will do a weight and diet episode.
right,
But
because it's absolutely not true. And the reason it's not true is because the tongue and the pulse never lie.
right.
So you can feel dampness in the pulse. You can see it on people's tongues. So if you have someone who is overweight and they don't have any dampness in their tongue or their pulse, then they don't have dampness.
Okay,
Right?
so
They have something else.
So now going back to cold and flu.
Sorry.
So is there an order of priority of treatment? Meaning, like with a cold, you just feel like crap generally, right?
Yes.
But if I've got the flu and I'm nauseous and throwing up and everything, are you going to target the nausea and the vomiting
That's
first,
such
and
a good
then
question.
and then back up to expelling the rest of the flu, so to speak? Or that's like
Yeah.
debilitating me at the moment.
Yeah. Okay. So that's a really good question. And so we got to go a little bit into Chinese physiology just briefly, which is, we already talked about the Wei Qi, which is the Qi that's on the exterior, that's like armor that fights off whatever's coming to get us. But if it's not strong enough, or the pathogen is really powerful and it gets through the Wei Qi, what's next? Well, there's another layer in there, and that layer is called the Qi level. Okay. So when the pathogen gets to the Qi level, people get a little sicker. So they start having like lung symptoms and a lot of mucus and, maybe a bad cough, and maybe they're feeling, maybe they don't just feel hot. Maybe they actually are starting to have a little fever, like they're getting a little bit sicker. Then then we try and expel it from the Qi level.
Okay.
Which would be different herbs and different techniques, because
Okay.
you're already sick now.
Right.
So now we got to get rid of it. Okay. But if we're unsuccessful and it goes deeper, then it goes to the yin level. And the yin level is really deep. And then you've got nausea, vomiting, a fever. You feel terrible. Okay. You're really, really sick. You're in bed. You feel awful. So that's when you're really, really, really sick. And so the strategy for treating you when you're that sick is a completely different strategy than the other two. And then finally, if I don't want to give you a percentage, but most people, like, that's the flu. Like,
Okay.
that's when you're really miserable. And we can help you get over that. And as the pathogen leaves, it leaves going from the Qi level to the Yin level to the Wei level. Like, as it came in,
It goes out.
so
right.
it goes out. And so you'll actually have your symptoms change as it gets deeper and deeper, and they get worse and worse. And then as you get better, and they get better and better, it's the same order. It's
Okay,
really
but
kind
so
of interesting.
the answer to that question that I gave was that you determine which level
Yeah.
you think that's at. You attack that level and
Yes.
start moving it
out.
whichever 1, 2, or 3 more levels
Yes.
it has to go out, and that will
Yes.
start to relieve the symptoms. And
Right. Now, see, at the yin level, if it starts getting even worse, then usually you're ending up in the hospital.
oh, okay,
Yeah, and there is one level that's deeper than the yin level,
okay,
called the shu level.
The what?
Shu.
Okay.
Shu, which means blood.
okay.
Okay,
Oh, that doesn't sound good.
Pardon my bad
Okay.
pronunciation.
And
But
what does the blood level
it's
happen? What happens
bad.
there? That's bad.
It's really bad. And the way that the shu level is differentiated from the yin level is there's bleeding.
okay.
Okay, usually it's called petechiae. It's like redness and little spots of blood under the skin.
Okay.
But it can actually be bleeding. So just to give you kind of a crazy example, Ebola.
Right.
Okay.
Right.
That's a classic example of a really bad pathogen that blows through the way the qi and the yin level,
Right to
like they're
the
not even there,
right.
and goes straight to the blood level, and people have horrible bleeding out of their, eyes and their mouth, and and they have terrible bleeding under the skin, and it's really serious and life threatening. So, but people can have diseases get to the blood level that are not evil, obviously. So that's you're in the hospital. That's really serious. So, what did I want to tell you? Oh, so a little side um,
Anecdote.
thank you, anecdote
Okay.
from that is when COVID happened. There's kind of a rock star in Chinese medicine, Dr. Chen, I forget his first name, who is from Taiwan, I believe. And there was a video going around right at the beginning of COVID that was in English, which was great, that um, was available to us English speakers. And it showed us the strategy, or the strategy, I guess, that the Chinese government put out just for regular folks. Like, okay, here's the Chinese government. We've got this disease. We don't really know what the heck's going on, but we know that a lot of people are getting really sick.
And we don't want 1 billion people in the hospital.
No, we don't.
Right.
So they immediately put out a strategy that everybody in China was familiar with. And what they said was, here's the 4 formulas, the 4 Chinese formulas. If you're not sick, but you want to keep from getting sick, take this formula, which was a formula to strengthen the Wei Qi, right? Then the second formula was, okay, if you feel like you're coming down with something, take this formula. And these were all formulas that are in every textbook of formulas, that are almost all Chinese people would know them. Things that their parents gave them when they were little,
And this is, as you say, just if you're feeling this, as
Right.
opposed to being clinically diagnosed or
Right,
anything. Okay.
right. And then if you come down with it and you're sick, take this formula, one of which was Huaxian Zhengqitang, the formula that I mentioned.
Okay.
And then if you're recovering, if you've already gone through it and you're recovering, take this formula. So they pretty much put out, everybody get these formulas. And in China, you can just go to the grocery store and get them.
Right.
It's easy. And they know what they are.
It's part of their routine. Right,
Yeah,
right,
yeah,
right.
and they know what they are. So that was a great thing for us to see translated into English at the beginning of COVID, because it gave us sort of a general, sort of a broad guideline of, okay, this makes sense. These 4 formulas are at least a place to start.
And it's probably too soon to start seeing the script and text of what these practitioners wrote that will carry forward to future practitioners and whatnot. Yeah. Like, do we know the results of these recommendations and courses of treatment?
Yes, I believe we do.
Like, they gave out correct information, right? And it
Absolutely.
And it helped abate the problem.
Oh,
and
yeah.
Keep 1 billion people up from hospitalization.
Yeah. No, they did really good. They did
Okay.
really good research, and they had really good monitoring of patients, because they're good at monitoring, like really good at monitoring.
But
And,
then when it hit these deeper levels, they're using Western remedies.
Well, yeah, they use
and Paxlovid and everything.
absolutely,
Yeah, okay.
absolutely, and that's one thing about
Right.
a lot of other countries is, they do use Western medicine just like we use here, but they also use
They don't go to it first.
no, and usually they can't. It's too expensive.
Right.
Yeah, everything in Western medicine, as we all know, is too expensive. And one thing about herbs is they're cheap. And that was one of the reasons that the Chinese government, one of the first things they did was said, here, go to the grocery store, get these herbs. These will really help you. And everybody pretty much knew that was true. So they could kind of help themselves.
What about on the herbal treatment side? Then, how will you prescribe and treat based on these various 4 levels that you diagnose with the cold or flu or in?
Yeah.
So you'll give us acupuncture, and then how big and important is take home herbal treatment? For that?
Really important. So there's a couple of things. One is there actually is a little formula that you don't even need to go to the store and buy, that you can make yourself.
Okay.
And this is for really early stage. Okay, like you just think maybe you might be feeling like you're coming down with something, but you don't know.
So you do this and Gamaling, or
Even before gunmelding.
Okay,
I mean,
okay.
this is something everybody can do, and you can make a formula. It's really super
Okay.
simple. You take a pot, you stick it on the stove.
can do that?
Yep, it's easy. You take some ginger root, chop up some slices. It doesn't matter how many. Throw them in the pot. Take the green part of green onions. Doesn't matter how many. Chop them up. Throw them in the pot. Hit it with a couple of tablespoons of brown sugar.
Okay.
Boil it up. Drink it.
Oh, okay.
Yep, it's really good. It's really, really good. I mean, I've actually had people say that it was like miraculous. Like they actually thought, I feel like I'm coming down with something, and they drank this, and that was the end of it. That's like super early stage. Then, if you feel like, ooh, I'm getting sicker, then you can take Ganmaling, which is that formula but stronger. Okay, so that's like a basic, like in China, that's something your grandma would have made.
Do we
you.
know anything about the science of that, of why that drink
Oh
works?
well, a lot of
I
these
mean, I know
things
people
are.
always tout the healing benefits of ginger, so that
Well, a lot of these things, in Chinese medicine, yeah, it's the ginger is kind of affecting it's strengthening the internal part of the body. The green onion is strengthening the external part
Okay,
of
so
the body.
there's a purpose of
Oh
all
yeah, they
these.
didn't just like make it
Right,
up.
right,
Yeah, no, there was a reason. And then there's loads and loads of research into the Chinese herbs. More and more of it is in translation that we can actually read. But there's loads, like Ganmaling. A lot of the herbs in Ganmaling have been found to have a lot of antiviral qualities. So as in the West, because we have these big weapons, we have these big drugs, we've also created like strains of antibiotic-resistant bacteria, for example, which is really bad,
Yep.
really dangerous. And what they're finding is they're going back to using herbs for a lot of these cases
Interesting.
because the antibiotic-resistant bacteria isn't resistant to the herbal medicine,
Which is more like a food, as you've told us.
right? And so it's obviously not as strong, and there's a whole situation, with that. But yeah, it's. I mean, antibiotics really are like a miracle, but since they've been overused for so many years, then now we've kind of created a monster a little bit.
Okay, but going back to when you're treating us with acupuncture and you send us home, what kinds of herbal things? Well, you have different herbal things in your arsenal. You'll give us depending upon again which of these layers.
Yeah. I mean, and there's famous formulas like Yin Chao San is really famous, or Gagan Tang, or Ma Huang Tang, or all kinds of stuff. So like Ma Huang Tang is really good for wind cold.
Okay.
It's got ephedra in it, so every once in a while the FDA decides we can't have that, even though it's got such a little bit of ephedra in it. I mean, it's not like you could go make meth out of it. Like it's it's not like that. But and Ma Huang which is ephedra, is a plant that grows here locally in the Mojave Desert, as a matter of fact. And the colloquial name for it is Mormon tea.
Oh, interesting.
Yeah, and it's a really interesting plant. If you go hiking here, it grows everywhere. You can see it. And it's a little bit of a stimulant when you drink it. And it's really good for a wind cold. It's really hot. And anyway, yeah, so there's specific formulas. Usually I kind of stick with Ganmaling, because I don't want the patients to have to figure out, do I have a cold or a heat?
Right.
I don't want them to figure that out.
But after you've treated us, and now you know what it is and whatnot. Then you're fitting a herbal formula to what we've got, and B, as you told us, the level deep of depth that the thing is at.
Yeah. So that's really good. So the moral of the story is that wind is bad, so stay out of the wind. The other thing, allergies, right? So
and sometimes you don't know that
you
whether
don't
it's an
know.
allergy or a cold,
right? Especially here,
Right.
Like yesterday we had a dust advisory,
Yep.
which is just brutal. I mean, it's you're
No, it's literally sand blowing around in the air.
but it's even smaller than sand.
Right.
But all of a sudden your eyes are itchy and they swell up, and all of a sudden your nose is all stuffy, and you're like, what is? The other day, what was it? Just a couple days ago, I was driving to work and I thought, what is that smell? It smells terrible. And I thought, is there something dead in the car? Like, what is it? And I rolled down the window and it was outside, and then I could see it.
Ooh.
and it was pollen.
Yeah. Oh, yeah.
And
Well,
it's
we get
like,
pollen like this
oh
thick
my
this time of year.
God. And then every single patient I saw said, oh, my allergies are acting up. And I was like, yeah, no wonder. I mean, it's just awful here. So there's that. And I mean, there's there's
But you
allergies in
treat
other
allergies and
climates.
cold differently and
Well, it
cold.
kind of depends.
Okay.
It kind of depends. So, like, let's say somebody shows up and their pulse is telling me that they're coming down with something. And their symptoms are what they tell me are these are my seasonal allergy symptoms that I get every February, right?
But we may
Okay.
not know the difference.
Yeah. And allergies in Chinese medicine they can be related to a couple of different organ systems, right? So they can be either like a lung system or they could be like a spleen system, a couple different things. So then their pulse should tell me, okay, yeah, they've got this pulse is kind of showing me it's coming in from the exterior, but this pulse is telling me that it's really affecting this one internal organ. So I'm thinking this is an allergy, or what in the West we would call it an allergy. So then it's like gunmelding's not actually the right thing to do because
Mm.
it's not an EPI. It's not that. It's something in the environment that they're reacting to. And a lot of times that's a spleen problem. So then with Chinese medicine, then we strengthen the spleen and then those symptoms go away.
Right.
So it's but that's pretty sophisticated. I mean, that's not something a patient would be able to
Right,
know on
right,
their
right.
own.
What about the other things in your arsenal? Like I imagine moxa for strengthening would be huge when you
Well,
cold or
moxa
flu.
would be good for a wind cold. Um,
Oh, would you use it for wind heat or no because it's hot?
I gotta think about that. Probably not. Because you got to be careful about strength. And like mox is like a vitamin, right?
Okay.
So if you've got somebody who's fighting off a pathogen and then you strengthen them,
You don't want to strengthen
you
the
can
pathogen.
strengthen the pathogen. So you don't want to do
Right,
that.
right.
That could be bad.
Right.
So yeah, we don't really use that. But one other thing that can be really helpful when people are having a wind cold or a wind heat or even the flu or even allergies is cupping, which
Okay.
most people are know what cupping is, those big suction cup things. There's a technique called flash cupping, which is a different kind of a technique.
Yeah, because normally we associate cupping with muscle relief and
Right, and we
whatnot
kind of put them on and leave them there. We
Right,
put them
right,
on
right.
and move them around like this. Flash cupping is like, right? You put it on and take it off. Put it on, take it off. Put it on, take it off.
You can kind of
Yeah.
get that's working to like
Yeah, it
grab
breaks
it
things
and
up.
expel it. And
Right.
right.
I also one of my professors once I had what did I had a real lung heat problem. So it was a type of flu. I had a fever, but it was all here. It was all in my chest. It didn't get deeper, and I was coughing up horrible stuff. And he did what's called bleeding cupping.
Oh, what's
right,
that?
Right across my chest, right here. Yeah, it got my attention. I'll tell you that. I was a student. Yeah, so it's where you take a diabetic lancet and you go, and then you
then
put
cup
cups on
that?
it so the blood gets
So it's
sucked
really
out.
sucking,
Yeah.
and that's to suck out toxins
Yeah,
and everything.
yeah, it sucks out the blood.
You don't do you do that regularly?
No, I don't do it regularly, but I mean,
You've
I
done it,
certainly
yeah.
would. Oh yeah. Oh my God, it's great. And the thing is, it hurts because somebody just stuck a lancet in your
Right.
body and blood's coming up, but it feels good. Like my professor, Dr. Wong, did bleeding cupping on me when I was a student when I had a kidney stone, and he was so funny. So I went to the emergency room and they were like, you have diverticulitis. And I was like, no, I don't, and I went home and I was so sick and I couldn't sit still and I was just pacing and pacing and pacing. And so I went down to, I called Dr. Wong and he said, you have a kidney stone. He said, if we were in China, I could just send you down the hall to get a CAT scan but I can't do that here. And so he said, well, come down and see me. He was in Seattle and I was way far away from Seattle. So I was driving down and I was just like, oh my God, it was an agony. And I had an appointment with my medical doctor, who was a great medical doctor. She thought Chinese medicine was a bunch of crap, but she was a really good medical doctor. And I went to see her and she said, oh, you need to go down the hall and have a CAT scan. You have a kidney stone. I mean, she said like exactly the same thing that Dr. Wong said to me. And yeah, lo and behold, I had a kidney stone. So, anyway, so I stopped off at Dr. Wong's office and he cupped me over my kidney. And so what he did was he took and the pain was excruciating. And so he took a diabetic lancet and he went like that in my skin, and then he put a cup on it, right? And when he did that, my pain level just went
Wow.
down to nothing. I mean, it just went like instantaneously, and I just
Wow.
was like, "Oh my God." And he goes, "Susan, I have to show you your blood."
Ah,
And I was like, "Okay, what?" And he had all these tissues that he had like wiped the blood off, right? And he showed it to me, and I am not exaggerating at all. Okay. Around the outside, it was
yeah.
red
Yeah.
blood. And in the center, right where that cup was, where it sucked the blood out, it was black.
Oh,
I mean,
gross. What does
black like
that
your
mean?
pants and like worms. It
Oh,
looked like worms because it was all congealed
right,
blood.
right.
So it looked like these black worms, like black spaghetti. It was the most disgusting thing.
So it's what, a blockage that he's pulling
It's
out,
like
and that allows
yeah,
everything to get going
yeah,
again?
exactly. So, oh my God, it was great. And so I got in the car to drive home, and as I drove home, I could feel these little bits of like broken glass going like it broke up the kidney stone.
Wow.
It was amazing.
That's amazing.
So cupping, it can also be really useful. I mean, not well, obviously the kidney stone kind of isn't about colds and flu, but it's kind of a great story.
Okay, but so then let me ask you, as far as cold and flu, what should we not be doing that contributes to driving whatever level we've got deeper?
Oh, well, that's kind of, I mean, well, I don't really want to say.
Okay.
A lot of Western medications can suppress the pathogen and
Well, I can totally
make
get
it go
that
deeper.
because
So, but it's
everything you
not for
talk
me to
about is about
say,
expelling, and Western
right,
medicine is a lot more
is
about
clamping
tamping
it
down.
down.
Right.
So now, having said that, Western medicine is, kind of a miracle in a lot of ways. So I guess what I would say is I would encourage people to think of Western medications, even over-the-counter medications, as being the big guns.
Okay.
Like, let's try
And a
something.
later line of defense.
Let's
Right.
let's hold off just a little, and see if maybe you can expel this a little bit gentler without going to the big
It's
guns
hard
at
though, because when you
first.
feel that crappy,
It's
you'll take whatever you can,
right.
and
And
whatever
sometimes that's the right thing to
combinations,
do.
and
Sometimes that's the right thing to do. So it's not for me to really say. But I have met people, and I think we've all met people over the years who I would say are very quick to jump to antibiotics or something really big. And I would say, don't do that, because they're really, really magical substances, and we should really hold off on them until we absolutely
So you need the
them.
magic, right?
Yeah, until we need the magic,
Right.
and then do it. I mean, I've had patients that refused to take antibiotics when that was ridiculous, when they absolutely had a bacterial infection and they were just being stupid.
Right.
And it's like, you want to suffer for 6 months, or you want to just take 5 days of antibiotics and be done with this?
Right.
What the heck? You might as well do it.
Okay, and then lastly, and then I'll let you get back to work. So going back to this wind thing, so
Wind.
obviously we know to wrap up in the winter,
Yes.
right? And you keep your neck wrapped. But so in the summer, you don't want hot wind coming
Correct.
in either. Okay,
Absolutely.
So like, what am I walking around with a summer scarf or something if it's windy out, or a summer hoodie or something? Okay.
Absolutely. Well, this is the wind gate,
Right,
so you don't want anything blowing on you. You just don't. I mean, here,
Because you don't think of yourself as being as susceptible to cold in the summer as you do in the winter.
yeah, except people get summer colds all the time.
Right.
And it's, and here, oh my goodness, here especially, it's 110 degrees outside, and then you walk into the grocery store and it's like, feels like it's 60 degrees and it's freezing. I mean, here we're in the desert and you need to have a hoodie in your car when it's in August in case you go into a store.
You go from 110 to 65 in many instances.
It's awful.
So,
and when you go into most grocery stores, what's the first thing that
it's
happens?
blowing right
They're
on you at the
blowing
doorway.
air on you.
Right.
And every time I walk into a grocery store like that, I just think, they're trying to make me sick here. I mean, of course, they're not making you sick on purpose.
What about
but-
like the head compared to the neck as far as a gait? Because like what you just said, a lot of times you walk in those stores, it's blowing on your head and not necessarily blowing on your neck.
That's a good question. Okay, so wind it's just like a tree, right? You look at a tree and the upper branches are moving a lot more than the lower branches.
Okay.
The upper part of the body is more susceptible to wind than the lower part of the body, which is not to say that people don't get wind in their lower body too. They do, but much more likely in the upper body. So yeah, this every from the waist up, basically.
From the waist up, okay.
Yeah.
All right, wow. Wind is bad. And
Wind is bad.
We will revisit that
We'll have
whole
to
episode.
revisit wind.
And we did one, and we'll do it again because people keep asking and talking about it. So cold and flu, never too late in the season to keep yourself aware of what you can and should not do so that you avoid them, because it totally sucks not feeling well. And remember, gum maling, which we put up here and I showed you a picture of, it should be in your arsenal. And the second you feel yourself coming down with something.
And the little formula with the sugar and the green onions and the ginger.
And the gingers.
We should put that up
have
too.
that tea, and we had that up
useful
for you. Make sure you keep that in home. As always, this is Susan Wellman. She's an Oriental medicine doctor and East Asian medical practitioner here in the Las Vegas, Nevada Valley. Her information also came up across the screen every so often, so you may get in touch with her with comments and questions and to make an appointment, which you may also put comments in the comment section down below. The stars of the show, who today were very cooperative and get extra kudos, are Leo the black flat hair and Marty the gray wire hair.
They're having their spa day soon.
Spa day soon. You may see them for one more show, I think, before spa day. And then they'll be groomed for the spring and summer. Anyways, this is the In Medicine and On Medicine podcast. I'm Scott. Thank you all for joining us. We will see you next time. Have yourself a great day. Stay out of that wind.